In 1971, the Nixon administration declared a war on drugs, labeling them as public enemy number one. 50 years later, the CDC has reported more than 100,000 drug overdose deaths from May 2020 to April 2021, the most overdose deaths ever recorded in a single year.
I came to serve in the Obama administration at the Office of National Drug Control Policy, and it was during a time when the overdose epidemic was increasing. And I came to be really aware of, first of all, just the inequities that how we address addiction in this country and the need for policy reform.
That's Regina LaBelle, former acting director of the Office of National Drug Control Policy for the Biden administration. She's now at the Georgetown Law Center as initiative director of the Addiction and Public Policy Initiative at the O'Neill Institute. LaBelle's time at the White House created an historic focus on harm reduction services in drug policy.
Not everybody that I meet is ready for a transformative life change. So we want to make sure that everybody has access to the information and resources that they need to be safe and healthy, regardless of how substances fit into their life. We all deserve basic health and safety. And so if that means that a person isn't ready, to stop using substances, doesn't feel like that's a realistic possibility given their current life circumstances, we want to make sure that they have things like fentanyl test strips, which can be used to test other substances for the presence of a very dangerous opioid called fentanyl that is responsible for the majority of overdose deaths in our country right now.
Dr. Trent Hall is an assistant professor of addiction medicine at the Ohio State University Wexner Medical Center. He says harm reduction services are not rehab. They're places that allow people to take drugs as safely as possible, helping keep users alive until they're ready to seek help. These services provide addicts with education and counseling, but also with overdose reversal medicine and fentanyl test strips. The Biden administration has been the first to prioritize harm reduction in the nation's approach to treating addiction.
Harm reduction is about meeting people where they are, but not leaving them there. And harm reduction efforts have been internationally known since the 80s. And in the United States, they've expanded across the country. Now, what's important about harm reduction programs is that they're places where people who use drugs can go to receive a number of services. It started as a place where you could go if you injected drugs, where you could go and get syringes or needles. And it's really expanded to provide an array of services that can include fentanyl test strips to test your drugs to make sure that there is no fentanyl present or to know if there is fentanyl present, to get testing services for hepatitis C and HIV, other healthcare, other services. So they really provide an array of resources and services that people who use drugs might need. And harm reduction services are really reducing the harms that may be associated with drug use.
A few harm reduction centers are scattered across the country, and LaBelle believes there should be more. These centers have been shown to help lower the rate of needle infections and overdose deaths.
There are millions of people in this country who are in recovery from a substance use disorder, and that recovery is possible, and that there's hope out there for people who may have a substance use disorder or may have a family member with a substance use disorder, and that there are resources that are available, definitely not as many as we need, but that hope is within reach and recovery is possible for people.
But as research shows, thousands of drug users don't live long enough to get clean. But Hall helped publish a study that shows overdoses are not exclusive to the older population and how the deaths of young people impact us long after they're gone.
We were really interested not just in the number of adolescents and young people who died from unintentional drug overdose, but really how many years of life that they lost as a group. Conventional reports regarding overdose mortality tended to focus on older individuals, which is appropriate because most individuals dying of overdose are older than adolescents and young people. But unfortunately, those reports also obscure this really dire public health crisis amongst adolescents and young people. And so we wanted to focus our research on this particularly vulnerable population.
The study published in JAMA Pediatrics recorded unintentional overdose deaths in adolescents and young people over the course of 5 years. Then it was taken a step further. Scientists measured the estimated lifespan of each person to find their years of life lost, something no other research has done.
But we wanted to specifically focus on years of life lost because what we know is that the death of an adolescent or a young person isn't just a single event. It's a loss that goes on forever for families and communities. And so we're losing a lot more years of family life and productive life and contribution to the community in the case of adolescents and young people who die of unintentional overdose.
Hall's research attacks the overdose epidemic from a different angle. It's certainly horrible when someone loses their life as a result of addiction, but it affects far more than just that one person. Countless birthdays never celebrated, families left forever one short, years of life lost for everyone.
As a physician who takes care of patients who survive overdose in the hospital, I'm confronted with drug overdose every day. And just meeting patients and their families at bedside, you really get a sense of the gravity of this public health crisis. And in my own personal experience, when I was an adolescent, one of my close friends died of an unintentional drug overdose. And just seeing the suffering of his family and how it affected our entire community really drove home that, like I said, the loss of a young person is not just a single event. It's something that goes on and on.
The paper cites the CDC's data to figure out exactly how many adolescents and young people died over the 5-year period. The team then calculated the number of years each person should have lived if they had gotten a full life.
And for adolescents, so that's individuals between the ages of 10 and 19, adolescents lost nearly 200,000 years of life during the 5-year study period. And young people lost over 1.25 million years of life, again, just during this 5-year period. And so what our results show is that unintentional drug overdose really is an unacceptably high mortality burden on this particularly vulnerable population, and we really need to focus our prevention and public health measures to help adolescents and young people and prevent overdose.
Part of that prevention starts at home and in school. This means parents talking to their children and teachers encouraging discussion around substance abuse. Hall says teens can feel invincible, and we need to help them realize the too frequent connection between drug use and death. Hall thinks doctors should also play a critical role.
Family physicians and pediatricians, primary care physicians, should really be screening adolescents and young people as a part of a routine health exam for substance use, and then making sure that they're able to connect adolescents and young people to evidence-based treatment for addiction. Because we know that addiction really is a disease that often begins in adolescence, and it's so critical that we intervene early to avoid negative outcomes like fatal overdose.
So we have siloed addiction treatment. It's been siloed outside of mainstream healthcare. So the majority of healthcare providers are not screening or providing early intervention for people who may have risky substance use, may have substance use disorders. So that siloed approach to addiction is another way that we've kept from advancing in our approach.
LaBelle says insurance companies handle drug addiction disorders significantly differently than other mental health issues. She thinks it's important for addiction treatment to become less taboo.
So I think that there has been a real effort to stigmatize drug use in an effort to reduce drug use. And so there was in the past a belief that harm reduction led to more drug use. And we know from research that that's not accurate. But I think the issue is that We have seen in this country all too often that drug use is a moral failing and that substance use disorders are a moral failing. So we've approached it in such a way that we've made efforts to stigmatize people who might have addiction, and that has resulted in more punitive policies.
Treating addiction as an illness is just one step towards LaBelle's end goal. She hopes future prevention starts before drugs are ever introduced into someone's life.
The ultimate goal needs to be that we have society, communities that reduce the factors that might lead to risky substance use, and particularly risky substance use at a young age. So decreasing adverse childhood experiences, decreasing the trauma that may come from incarceration. Those are things, societal issues, that we need to address.
One potential solution, LaBelle suggests, is to have doctors screen patients for substance abuse and addiction. While we wait for more changes to take hold, Hall believes there are things we can do now that can make a big difference.
Kind of the long and short of it is, addiction is a chronic health problem. Slip-ups are a part of the journey for most people, even people who end up with this way in the rearview mirror. And because slip-ups are so common, it's important that we have harm reduction services because it's the most humane and realistic vision for healthcare for this health condition, and will hopefully enable people to be healthier and safer and survive to a point in their life when they are ready for a change.
You can find more information about Dr. Trent Hall, Regina LaBelle, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
There is a lot of competing information about what child maltreatment looked like during this time.
How did the pandemic affect rates of child abuse?
Then are electric cars requiring lithium as environmentally friendly as we think?
In order to get lithium, you need to literally destroy nature.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The families that I spoke to, every single one of them, their main priority was first the safety of their children, getting them to a safe space.
The refugee crisis in and around Ukraine, as well as across the globe. Then,
they're not designed to last. They're designed to realize a profit very quickly.
Understanding the declining quality of the clothes we buy. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.